ask you, as a mom, let's say, God forbid, one of my children, I don't even know has type 1 or type 2 diabetes, but how would I think, oh boy, there's just something not right here? Now, you already just did say a couple of things: sleep apnea, weight gain, etc. Anything else?
Well, you may not even be seeing those things at first. So you may not even know that your child has high blood pressure, or and that can even come later. Okay, if at all. Okay. But some of the signals for diabetes: frequent urination, excessive thirst. This is a type of thirst that a child cannot get enough to drink.
Okay.
Excessive hunger. Weight loss, like I mentioned before, it's not necessarily going to occur in type 2 diabetes. And in type 2 diabetes in children, we're typically going to see a child that's 85 percentile weight for age and sex. They're above that 85%. 85 percentile.
Right.
Blurred vision, that's what happens when the blood sugar gets really high. Fatigue, they're tired. Headache, occasional muscle cramps, poor wound healing. Now, a person and or a child, they can have several of these symptoms. They could have all of them. They could only have 2 or 3 of them that's evident.
All right. And two, I guess it should be said, just let's say if your child experiences some muscle cramps, that doesn't mean, oh my, we're in trouble, we have diabetes. Of course not. Just one symptom by itself too doesn't necessarily mean they're thirsty sometimes.
I've talked with parents in the past year, and they were watching their children and noticed that they were drinking a lot more water, or just drinking a lot more beverages, and that they were complaining of being thirsty, and they were going to the bathroom more. Well, it was hot out, the kids were playing, they were drinking more, they were going to the bathroom more.
Sure, makes
sense.
So
it is possible to miss.
Okay, very good. How is it treated?
How is it treated? Well, in type 2 diabetes, the physician is going to approach that differently and treat that a little bit differently than with type 1 diabetes. Okay, but with type 2 diabetes, first of all, we want to be proactive. Okay, if you're, and this is kind of backing up a little bit to what we just covered. If the pediatrician has told you at your well child visit, or even a sick child visit, hey, your child is greater than the 85th percentile weight for age and sex, ask what you can do about it. Remember that number, 85 percentile, okay? They're going to have places that they can refer you to. I'm actually working right now to make that better in the Charlotte area.
Great.
So you may be seeing more about that. I can't give any details now, but when you see that out there, just be aware that the Lord's been working. Okay?
Great.
So I'm pretty excited about that. Again, I mentioned overweight and obesity is the #1 predictor of type 2 diabetes in children. And I said that again as far as for the treatment, because what we need to do is we need to establish some lifestyle interventions and behavioral interventions. And these often involve nutrition and physical activity.
Sure.
We are not going to put your kid on this strict diet. Okay, we're going to be real. And every professional diabetes educator in this area is going to do exactly what I just mentioned. Okay, we're going to be real about it.
Good.
Okay. Diabetes self-management training, education that's geared toward the children, okay, and geared toward the parent. And one of the things that I talk about, when I come in, if I see a child and I know that that parent is a single parent, I'm going to be talking about single parent things.
Very good. Good.
And I'm going to say if vegetables is something that we want to include more of, I'm going to say, hey, I just looked at the sale ad at the local grocery store this week, and this is on sale.
Oh,
I try to give very practical interventions. Medication intervention. Oftentimes in children, we're already at the point where we have to intervene with medication. Now, is that going to be in pill form or an injection, which would be insulin? You know, it's purely, that's going to be based on whatever the physician finds out and whatever the physician knows that's going to be needed to get those blood sugars in a controlled range. Social support and psychological intervention, that's going to be provided too. Those are all important things.
You mentioned just a few minutes ago that there might be something coming down the road that we'll pray for and hope for and might see. In the meantime, what can parents count on, single parent or not, in the area of diabetes as far as resources are concerned, from learning more about it to support group maybe, or whatever else might work?
As far as in our area here, we don't have the things in place that we should have for being this big of a town.
Okay.
But what is available is, number one, your pediatrician. And in diabetes, they're typically going to refer to a physician that's going to specialize in pediatric diabetes, a pediatric endocrinologist. We have some great physicians in this area that specialize in that. They're also going to be the ones that are going to have a lot of key connections. As far as social support, there are camps out there available for kids with diabetes.
Oh, that's nice.
There are support groups that are out there, and definitely just meeting with a diabetes educator. That's going to provide some support too.
Very good. I should back up a little bit. I didn't ask you this, and I don't think we covered it. Is it the blood sugar, I guess, is that how you diagnose the kids, or do they have to go through a battery of tests, or is it something that hopefully a parent won't be afraid to bring their kids and go, oh no, I've got to go through all of this? Is it fairly simply straightforward?
Yeah, I mean, it's not, there is, you know, a blood test that's going to be typically, you know, that's going to be involved, definitely. And, you know, we mentioned, you know, we discussed some physical symptoms already about, you know, the 85 percentile weight for age and sex. Okay. And it's going to be very important that it's diagnosed correctly, and a physician's going to be the one to do that. But what I can say is that physicians are going to rely on the signals and the symptoms. Remember, we talked about the signals for diabetes. Well, when a parent is coming in and saying, this is what I've observed, that physician is going to be thinking diabetes. Okay. They're also going to depend on lab work, which we just discussed, you know, a blood draw. They're also going to look at family history.
Oh, we haven't talked about that. Sure. So this is genetic?
I
both?
Don't have the percentages with me about the chances or the risk of developing type 1 or type 2 diabetes in children. But with type 2 diabetes, we do see patterns there. Okay, in family history, it can be genetics, but it can also be social.
Wow.
Okay.
Okay.
And I mean, if you have one parent or two parents that are considered what we call obese, which is a body mass index of 30 or greater, that's when, the physician's going to look at that and say, oh, well, you know, maybe I need to look a little closer than this. But there is one thing that's going to be kind of different, that's going to be noticeable. There is something called acanthosis nigricans. And this is commonly noted in children and adolescents that have insulin resistance and that are producing a lot of insulin, meaning that they have a lot of insulin that's there in the bloodstream. It is actually a darkened thick, and I'm touching my neck, you know, because we see it often there a lot. It's a dark and thick, almost velvety looking skin.
Huh.